Kernan Orthopaedics and Rehabilitation Hospital, part of the University of Maryland Medical System, home to University of Maryland Orthopaedics and Community Orthopaedics in the Baltimore area, is now offering a unique regional anesthesia-based post-operative pain management system. This program utilizes a custom-designed ambIT infusion therapy pump.
We developed a home nerve catheter program where the patients receive continuous local anesthetic as part of their analgesic regime post-op.
With this system, the area of surgery can be kept relatively numb for up to 3 days post-operatively. This keeps the patients much more comfortable. They require far less narcotics and are able to participate more actively and effectively in physical therapy and activities of daily living.
I broke my elbow. Really messed it up, so to speak. Ripped up the tendons, ligaments, pulverized the muscle, not to mention breaking the bones.
I was a patient at Kernan Hospital because I had fell and broke my right wrist, and I had surgery there, and the doctor suggested maybe I try the ambIT pump.
I had the pleasure of having an ambIT pump after my right rotator cuff surgery, which helped to maintain and manage my pain post-op.
For the first couple surgeries, I didn't get to use the ambIT, which actually made it very difficult to go through the therapy after the surgery because the pain was quite exceptional. I could barely move, was barely tolerable. Sleeping was definitely a challenge.
I think the ambIT's been very beneficial to the patients. It helps reassure them that they can have the surgery and go home and have something extra to use to help control their pain.
That ambIT delivers the medicine to them every hour if they do nothing at all. And that usually brings a lot of comfort. If they do nothing at all, they'll get some medicine every single hour.
My pain was very well managed due to the ambIT pump. It required less narcotics in the very beginning post-op.
I had the pump on for 4 days, which I loved because I didn't have any pain at all.
It was wonderful. It worked. Sleeping, I was able to sleep. Therapy, definitely tolerable. I was able to hit the button, get a small dose extra, and just go right into therapy. I was able to move, which was just astounding for me. From going from doing this to actually being able to rotate my wrist for just one of my surgeries, having the ambIT help out with that, it was just lovely.
About 4 years ago, when we surveyed all of our patients, we found that about 15% had pain scores that were 6 or greater on post-operative day 1, which was unacceptable. This was despite the fact that they left our institution with pain scores of 0 to 2 because their extremities were numb from the regional anesthesia. We started doing indwelling catheters about 4 or 5 years ago, but found that there was a large hassle factor involved. We were using elastomeric pumps. There was question of who would fill the pumps. The pharmacy was not really set up for that. The nurses in the operating room really didn't want to be filling the pumps. So it turned out that the anesthesiologists were filling the pumps, were hooking up the pumps to the patients, and doing a large part of the education. And this was taking away from our other responsibilities, so there was general reluctance to continue to use the elastomeric pumps. We then found the ambIT pump, which we knew from its use in the military, and the ambIT pump seemed to fit our needs. The fact that the ambIT pump used a standard IV bag took care of the filling problem. The pharmacy was able to fill these bags like any other PCA bag. So in fact, when we looked at how our system worked for inpatients, the ambIT pump allowed us to duplicate this system in the outpatient population. The learning curve for the pumps was very short, and in fact there was very quick and wide acceptance from both the nursing staff and the anesthesia staff. Those anesthesiologists who had been reluctant to place catheters because of the hassle factor quickly adopted this, And over the course of about a year of using the ambIT pumps, the number of catheters placed quadrupled. In addition, the unacceptable pain scores, which were, as I mentioned, around 14%, within a year dropped down to below 4%.
We have found that patients have been very successful with their pain control postoperatively for up to almost 2.5 to 3 days, depending on the program that we've sent them home with.
When we make post-op calls the next day, we ask the patients how things are going, how's their pain. They usually are pretty comfortable. After a year of using the ambIT and making post-op calls, I've never had a patient have a question. I've never had them really report any problems with the pumps at home. It's been a good experience so far as our post-op calls can say. They've been problem-free. When we first were introduced to the ambIT, I think all of us as nurses are, we don't usually like new things because I think we're always a little bit, if not intimidated, we just don't always welcome a new thing that we have to figure it out and it's going to take a little more time.
Once we introduce the product, and the program, of course there's always resistance because it's new technology, it's something new, it's added to their workflow. We did a whole education campaign where we really taught them how to interface with the pump, how to set it up, how to prime it, and we had plenty of practice time. Basically it was train the trainer, and it worked very well.
It's simple now, very simple. We'll look up the order and we know the patient's coming out and going to have an ambIT. It's set up in about 5 minutes, ready to go, and usually sometimes the doctors will say they want it and we have it set up before they can actually get the order in. So it's been smooth.
One of the best things about the ambIT pump system is its reusability. Costs are, of course, a major concern to us as well as any healthcare institution, and the reusability of these pumps makes them very economical. The price of the pump itself is already competitive with the elastomeric options, but the fact that the refill kits are a fraction of that and that the pumps can be reused keeps the cost significantly lower.
We have a process where the patients put the pump back into a self-mailer envelope, self-addressed, stamped, and we receive them back, we reprocess them, we reset them, and then we put them back out into the circulation for utilization.
We were hoping to get about 10% of our pumps back. In fact, we're getting about 90% of our pumps back. We think we're getting this high return rate, number one, because the patients like the idea of recycling. We're able to show that we care about the environment and we're not just throwing all this plastic into the garbage after every patient. We also think that they send them back because they were happy with their care. By the time the pump runs out of medicine, usually on postoperative day 3, many of these patients are getting by simply on acetaminophen and non-steroidal medications. This is also helpful for patients who don't tolerate narcotics or patients who have a history of IV drug abuse. One of the best things about working with the ambIT pump and Summit Medical is the personalized service that we've received from Summit. When I first started using the preset pump, none of the presets were really applicable to our patient population. Summit immediately offered to customize the settings and make pumps specifically for us and our needs. They also offered to make the pump in whatever color we would like and also to put our logo on the pump. Thus, it became great marketing for the hospital to have our name on our custom pump system. This worked really well for us because we were able to match up the presets to our computer ordering system using one of 3 or 4 choices that would be our standard pump settings, exactly as we do with our existing PCA and peripheral nerve block pumps on the floor. This meant that the nurses could program these pumps very quickly, and it really worked well. We actually started going through pumps much, much faster than we thought. And in fact, when we would unexpectedly run out, I could call Summit, I would get someone at a high level very quickly, and they would always take care of us. We would have shipment delivered by Federal Express by 8:30 the next morning, and never were we without the pumps.
It's really a fantastic device. I think the nurses have been real happy that that they're able to keep their patients at a lower pain level.
It certainly worked for me. I can only imagine it would work wonders for another person.
I would highly recommend other patients having the same type of surgery to go home with the ambIT pump.
I would recommend the ambIT pump to anybody who had to have surgery or any type of extremity because the pain was so well controlled.
Going through it, having surgeries with and without, I would definitely go with. I would recommend it because it works and it was a boon.
We at Kernan Hospital have been very pleased with our experience with the ambIT pump. It fits our needs and the patient's needs, and of all the systems available that we looked at, clearly this was the best.
It was just wonderful, completely painless, all of it, and it was just wonderful. I liked it a lot.